Hello everyone, welcome to my YouTube channel Pharma Researcher. So this is the video number 11 of Telangana Pharmacist Grade-II exam preparation. The exam is going to be held on the 30th of November 2024, and in this particular series we are covering a total of 10 units as per the syllabus, and the initial 4 units have already been covered, and the links of the other videos is added in the description box. You can simply watch those videos, and in today's video we are going to discuss the unit number 5 part 2, the remaining topics regarding the pharmacology of drugs. Basically there are different sub classification. So this video was about to come yesterday, but it was not I am unable to post it yesterday. So now you are getting this video early in the morning, so you can watch this video. So for the PDF of the video, you can simply go to the description box. There I have provided you the link of PDF. You can simply download the video. So these are the different topics which are going to be covered in this particular video. So pharmacology of following classes of drugs: general anesthetics, analgesics, NSAIDs, then again narcotic analgesics, antiemetic, sedative hypnotics, and all these classification. Also for all these classification I have added the pharmacological classification from KD Tripathi. So that took a long time, so that's why the video is late. So after the MCQ questions, I have added all the classification all together. So you can simply check out the classification, check out each class and the drugs which are used in different conditions. So these are very important. So mostly what kind of questions will be framed in these particular classification? So basically the question can be from some are direct question like which of the following is antitussive drug, which of the following is adrenergic agonist, which of the following is cardiotonic. So this type of questions can be there. Or sometimes there can be classification based question which are very specific classification, like if there are antiarrhythmic agents. So there are different classes: class 1, class 2, class 3, class 4 drugs are there. So there can be a specific drug like which of the following drug comes under class 2 or class 3 of antiarrhythmic drugs. So in that way the question will be arising. The other are basically the based on side effects and other things. So those things will also be covered in the adverse drug reaction part, that is the toxicology part, which is 8th or 9th unit. So in that we will be covering the side effect or adverse reaction parts. So many question you will find here also, and all the classification will be there all together. So you can download the PDF and you can simply visit the all the classification in one go. Now we can start with the first question. So first question is, which of the following is intravenous general anesthetics? So basically what are general anesthetic? These are basically anesthetize the whole body. General anesthetics are used for whole body, and there are local anesthetic which simply anesthetize a local part or a particular area of the body. So here the question is intravenous general anesthetics. So in intravenous general anesthetic, the answer will be thiopentone sodium. So here option D will be the correct answer. In this, the nitrous oxide is gas inhalational, general anesthetic, while the halothane and ether, these both are the volatile liquids. These are both are the volatile liquids general anesthetics. So in this particular question, option D will be the correct answer. Then we can simply move to the next question. So the question is, identify the preferential COX-2 inhibitor. So the preferential COX-2 inhibitor is nimesulide. So here option A will be the correct answer. Basically, there are different non-steroidal anti-inflammatory drugs. Different classes are there. Several are selective COX-2 inhibitors. So celecoxib, parecoxib, and etoricoxib. These are the selective. These are the selective COX-2 inhibitors. So sometimes from this classification you will find the question. So these are the selective COX-2 inhibitor, which includes celecoxib. Wherever the coxib is there, those are the selective COX-2 inhibitors. Now we can move to the next question. So the question is, which of the following is a synthetic opioid analgesic? So we need to identify the synthetic opioid analgesic. So here the morphine is the natural, it is natural opioid anesthetic. Heroin is semi synthetic, heroin comes under semi synthetic. Pethidine is a synthetic, pethidine comes under synthetic opioid analgesic. And codeine is again the natural, it is again the natural opioid analgesic. So here option C will be the correct answer. That is, pethidine is the synthetic opioid analgesic. So here option C will be the correct answer. Then there is another name for pethidine. So pethidine is also known as meperidine. So this alternative name can be given as option. So these are the synthetic opioid analgesics. Next question is, anakinra is so what is anakinra? So anakinra is interleukin 1 antagonist. So here option A will be the correct answer. So basically these are the drugs which are used in rheumatoid arthritis. So in this particular category, anakinra is the drug, and these are the biologic response modifier. These comes under biologic response modifiers. So by the classification itself, if you read the classification of different drugs, so with the classification only you will be able to attempt 4 to 5 questions from this particular unit from classification only. The mechanism of action you will be get to know from the classification only. And only the thing is, you have to understand the classification as well. Only then you will be able to get the answers right. So here if I'll talk about TNF alpha inhibitors, so these are also the biologic response modifiers. We can abbreviate it as VRMs. These are the biologic response modifiers, and these include etanercept drug. It include infliximab. These include adalimumab. So these are the TNF alpha inhibitors. Then if I'll talk about the immunosuppressants, so immunosuppressants includes methotrexate, azathioprine. It can be cyclosporin. So these are the immunosuppressant, or we can say these immunosuppressants are a subpart of disease modifying anti-rheumatic drugs. So this is abbreviation: D for disease, M for modifying, A is for anti, R is for rheumatic, and D is for drugs. So this class sometimes can be asked like, which of the following drugs comes under this class? So methotrexate, azathioprine, cyclosporin, these are the immunosuppressant under this class. Along with that, there are sulfasalazine. Sulfasalazine is another drug. Then chloroquine is another drug. Then leflunomide is another drug. So these are the different drugs which are the disease modifying anti-rheumatic drugs. Then we can move to the another question, that is, haloperidol is an antipsychotic drug, comes under which category? So basically the haloperidol is coming under vityrophenone category. So here option B will be the correct answer. Then if I'll talk about phenothiazine, under phenothiazine there can be a drug chlorpromazine. Chlorpromazine comes under phenothiazine category. And also there can be drug triflupromazine. There can be thioridazone. There can be trifluoperazine. So these drugs comes under phenothiazine category. If I'll talk about butyrophenol, haloperidol is there. Along with this, trifluperidol. Trifluperidol is also there. Then penflu, penfluridol. Penfluridol. This is another drug under butyrophenol category. Among these, haloperidol is quite important. Then under thioxanthines category, there can be a drug flupentixol, flupentixol, and under atypical neuroleptics, there can be drug clozapine, risperidone, olanzapine. So these are the different drugs which comes under atypical neuroleptics. Again, repeating, these classification has been provided you in the last after the last question, so you can again revisit these classifications and remember all the classes of drugs. Moving to another question. So the question is, which of the following is reversible anticholinesterase inhibitor? So the reversible anticholinesterase inhibitor include physostigmine, edrophonium, donepezil. These all the drugs are the reversible anticholinesterase inhibitors. So here option D, all of the above will be the correct answer. Then moving to the next question. So the question is, which of the following drug is alpha 2 blocker? So the first drug, yohimbine, it is a selective alpha 2 blocker. Then terazosin, alfuzosin, tensulosin. These all drugs are the alpha 1 blocker. These are the alpha 1 blocker. So here the correct answer will be option number A. Then moving to next question, the question is, which beta adrenergic blocker has additional alpha blocking property? So basically the question is saying like which is a beta as well as alpha blocker, means alpha plus beta blocker drug. So this drug is levetolol and carvedilol. These two drugs comes under this class. So here option D will be the correct answer. Here it will be both B and C. So this will be the correct answer. Next question is, which of the following is a respiratory stimulant? We need to find the respiratory stimulant among these drugs. So respiratory stimulant is doxaprem. So here option C is correct. And these are also known as analeptic drugs. So here option C will be the correct answer. You can call it as analeptic drugs. And if I'll talk about the strychnine drug, so strychnine is a anticonvulsant. It is used in convulsion condition. Then there is amphetamine, there is caffeine. These both drugs comes under psychostimulants. Then the next question is, which of the following is leukotriene antagonist? So among these drugs, montelukast and gefilugast, these both are the leukotriene antagonists. So here option C, both A and B is correct. Next question is, risperidone is, so risperidone drug, it is a 5-HT2 antagonist. So here option A will be the correct answer. It is a 5-HT2 antagonist. So option A is correct. Apart from risperidone, there can be drug under 5-HT2 antagonist. For example, ketenserin, then retin then there is clozapine, risperidone is there, olanzapine. So these drugs comes under 5-HT2 antagonist. Then talking about 5-HT3 antagonist, so this class is very important. So in this class of ondansetron drug is there. So this ondansetron is asked many times, like under which category it is coming. So it is 5-HT3 antagonist. Along with this, granisetron, then tropisetron. So these are the few examples of 5-HT3 antagonists. Then if I'll talk about 5-HT1B or 1D agonist, so this is the agonist. So under this class there can be several drugs, for example sumatriptan, there can be rizatriptan. So these are the different drugs comes under 5-HT1B or 1D agonist category. The next question is, which of the following antihypertensive drug is angiotensin receptor blocker? So the angiotensin receptor blocker among these is losartan. So here option B will be the correct answer. If I'll talk about captopril, it is a ACE inhibitor. Means ACE is basically an enzyme which is involved in the conversion of angiotensin 1 to angiotensin 2. So this enzyme, ACE enzyme, is responsible for this conversion. So captopril basically inhibits this particular enzyme only. Then if I'll talk about verapamil, so verapamil is calcium channel blocker. It is calcium channel blocker. And the furosemide is a diuretic drug. Next question is, which of the following drug is potassium channel opener? So the only example of potassium channel block opener is nicorandil. So here option D will be the correct answer. Then moving to the next question. The question is, which of the following is class 2 antiarrhythmic drug? We need to find out the class 2 antiarrhythmic drug. So under this particular class, the drugs which are coming under this class is propranolol, because it is class 2. So class 2 includes the beta blockers is class 2. So here option B will be the correct answer. So there are basically four classes based subcategories also. First one is class 1 antiarrhythmic drugs, which are sodium channel blockers. So this include quinidine, procainamide, lidocaine, flecainamide, propafenone. So these comes under class 1 antiarrhythmic category, and there are further subcategories 1A, 1B, and 1C. So these you can see in the classification part. Then there is class 3 as well. In class 3, there are several categories like these are the agents widening the atrial polarization. So these basically prolong repolarization. So in this there are several calcium channel blockers as well, amiodarone. There can be Britaglium. So these different drugs comes under this class. Then there is class number 4. Class number 4 includes the purely calcium channel blockers, which includes verapamil and diltiazem. These comes under class 4 category. Now we can move to next question. So the question is, dash is referred to as a state of unconsciousness. So a state of unconsciousness is anesthesia. So here option A will be the correct answer. Next question is, general anesthetics act over. So basically the general anesthetic will act on the complete body. So here option A is correct. And the local anesthetic, these covers only local area or partial body or very specific body part. So next question is, patient is not breathing, heartbeat may or may not be present. This stage is known as. So in patients, if the breathing is not there, heartbeat is not there, so this is a particular stage in general anesthesia, which is the stage of medullary depression. So here option D is correct. So basically, there are four stages of general anesthesia. These four stages, at least names you have to remember. So the first stage is analgesia only. This is the first stage. Second stage is excitement or delirium. and surgical anesthesia is the third stage, and medullary depression is the fourth stage, in which medullary depression is there, and sometimes coma or death can happen. Next question is, which one is not a classification of general anesthesia? So we need to identify like which is not a classification of general anesthesia. So we have seen gaseous, intravenous, inhalational. These are the three main important like classes of general anesthesia. Different drugs will be there. But intramuscular is not any class of the general anesthesia. So here option D will be the correct answer. Next question is, dash is a barbiturate having very high lipid solubility. So the drug which is having very high lipid solubility is thiopentone sodium. So here option B will be the correct answer. Next question is, dash reduces the elevated body temperature. So the drugs which reduces the elevated body temperature are antipyretics. So here option A will be the correct answer. Next question is, which one is not a classification of NSAIDs, that is non-steroidal anti-inflammatory drugs? So we have seen non-selective COX inhibitors, preferential COX-2 inhibitors are there, selective COX-2 inhibitors are there. So these are the three main important classes of NSAIDs, but competitive inhibitor is not any class of NSAIDs. So here option D is correct. Next question is, dash function gets disturbed because NSAIDs prevent the formation of thromboxane A2. So basically the platelet function is mostly get disturbed because NSAIDs prevent the formation of thromboxanes. Then moving to next question. So the question is, dash has an antiplatelet effect, though it is relatively mild and short-lived than aspirin or other better known antiplatelet drugs. So among these non-steroidal anti-inflammatory drugs, which drug is having antiplatelet effect apart from aspirin? Because at low dose aspirin is behaves as antiplatelet, but apart from this drug, ibuprofen is also a drug which is having antiplatelet effect. So here option A is correct. Next question is, dash gets partly converted into morphine within the body. So basically this drug is the codeine drug, which is also the antitussive drug. It is an antitussive drug. So this drug is partly converted into morphine within the body, and codeine is the active form of drug. It has activity, and its metabolite, we can say it is the metabolite. Morphine is a metabolite of codeine in the body, and it is also the active form, and these act as the analgesics. Next question is, dash is an inhibitor of dihydrofolate reductase and has immunosuppressant and anti-inflammatory actions. So this particular drug is methotrexate. So methotrexate is dihydrofolate reductase inhibitor, DHFR inhibitor, and it has immunosuppressant properties as well as anti-inflammatory properties. Next question is, the meaning of amnesia is, so the meaning of amnesia is the loss of memory. So here option C is correct. Next question is, meaning of analgesia is, so analgesia means pain relief. So here option A is correct. Next question is, nitrous oxide is a gas having dash odor. So basically nitrous oxide is having a sweetish odor, sweetish smell. So here option A is correct. Then next question is, dash is used to inhibit the clotting of blood and prevent strokes and heart attacks. So the drug which inhibits the clotting of blood is aspirin, basically antiplatelet drug, and at a low dose, it is behaving as antiplatelet. Apart from non-steroidal anti-inflammatory drugs, so it also prevents the strokes and heart attacks. So here option C is correct. Next question is, which of the following are indole derivatives? So the indole derivative drugs include indomethacin. It is a indole derivative. So basic ring present in this particular compound is indole ring. So here option C is correct. Next question is aspirin is. So aspirin is also important question, this one. So aspirin is acetyl salicylic acid. So here option A is correct. Next question is CTZ stands for. So CTZ basically it stands for chemoreceptor trigger zone. So here option D will be the correct answer. Next question is DMARDs stands for. So DMARDs it basically stands for disease modifying anti-rheumatic drugs, and we have seen the classification of drugs in under this class as well. So now we can move to next question. So next question is SAARDs stands for. So SAARD. So it stands for slow acting anti-rheumatic drugs. So here option B will be the correct answer. Next question is dash produce sleep resembling natural sleep. So a kind of sleep which is just like the natural sleep only, and these are the drugs known as hypnotics which have the section. So here option B is correct. Next question is barbiturates produce adverse effects like. Basically, barbiturates are the drugs which can produce hypersensitivity, acute barbiturate poisoning, idiosyncrasy. So these type of adverse effect can be seen. So here option D, all of the above is correct. Next question is reserpine is an example of. So reserpine is basically an example of raw wolfia alkaloid. So here option B is the correct answer. Next question is chlorpromazine and haloperidol are used in mania along with dash therapy. So chlorpromazine and haloperidol, these are the anti-manic drugs, and these are given along with lithium therapy. So here option A will be the correct answer. Then next question is fluoxetine is an example of. So fluoxetine, this drug is also asked multiple times. So it is an example of selective serotonin reuptake inhibitors. So here option C is correct. Next question is the selective MAO-B inhibitor dash is used for treating Parkinsonism. So selective MAO-B inhibitor is basically selegiline. It is a selective MAO-B inhibitor. So here option C is correct. Next question is MAO-B is present in. So what is the source of MAO-B? It is basically, or we can say, the storage area of MAO-B enzyme. So it is present in central nervous system as well as in blood platelets. So here options D, both A and B is correct. Next question is dash is the first line treatment of Parkinson's disease. So the first line treatment for Parkinson's disease is levodopa, which is an inactive form of drug, and it becomes active in the body through biotransformation process. Biotransformation process. Then next question is levodopa converts into dopamine by. So by which enzyme this conversion will be possible? So dopamine is basically the requirement, and levodopa is product. So levodopa can easily cross the blood-brain barrier and it reaches the systemic circulation as well. So levodopa it basically converts into dopamine by the dopa decarboxylase enzyme. So here option A will be the correct answer. So this is a barrier. So here it is periphery area. This is a brain area. So what happens like dopa levodopa can be converted to dopamine in the periphery only through this enzyme, dopa decarboxylase enzyme, and also this enzyme is present on the other side, like in the brain part as well. So there can be a conversion of this in the periphery only. Then there will be no use of that dopamine if it gets converted into levodopa gets converted into dopamine initially before going to the brain, then it will be of no use. Now that's why we give carbidopa along with these compounds. Next question is, dash is a local anesthetic used as a class 1b antiarrhythmic drug. So the class B antiarrhythmic drug include lidocaine. So here option B is correct. Next question is, which benzodiazepines is used in manic depression? So the enzyme which is used in manic depression, so this drug is clonazepam. So here option B is correct. Next question is, which of the following drug is long-acting barbiturates? So basically the long-acting barbiturates include secobarbital, phenobarbital, amylomethoxy. So phenobarbital is a long-acting barbiturate. So here option B is the correct answer. Next question is, which of the following drug are ultra short acting barbiturates? So ultra short acting barbiturates include methotrexate. So here option D is correct. Next question is, which of the following are derivatives of phenothiazines? So the derivatives of phenothiazine includes chlorpromazine. So here option A will be the correct answer. Next question is, which of the following are atypical antidepressants? So the atypical antidepressants, these includes trazodone. Trazodone is the example of atypical antidepressant. So here option B is correct. Next question is, SSRIs stands for. So SSRI is selective serotonin reuptake inhibitor. So here option D will be the correct answer. Then next question is, which of the following are SSRI selective serotonin reuptake inhibitors? So on these in this drugs includes fluvoxamine. So here option C is correct. So this is basically the fluoxetine. So here option C is correct. Next question is, SNRI stands for. SNRI stands for. So SNRI is the full form of fluo. So SNRI is the full form of serotonin and noradrenaline reuptake inhibitor. So here option D is correct. Next question is, which of the following is GABA agonist? So the compound which is a GABA agonist is gabapentin. So here option B is the correct answer. Next question is, which of the following are hydantoin derivatives? So the hydantoin derivative include phenytoin. So here option A is correct. Other than those drugs are not hydantoin derivatives. So here option A will be the only correct answer. Next question is, which of the following are GABA transaminase inhibitors? So the gamma transaminase inhibitors uh, are Vigabatrin. So here option A is correct. Then the another question is, which of the following are CUMT inhibitors of Parkinson disease? CUMT is carboxy or methyltransferase inhibitor. So these are the drugs used in Parkinsonism condition. So here the question answer will be entacapone. So here option D is correct. Next question is, levodopa crosses the blood-brain barrier and converts into. So it basically converts into dopamine as it is a prodrug. The main drug is dopamine. So here option A is only correct. Next question is, dash is used for treating myasthenia gravis. So in order to treat myasthenia gravis condition, neostigmine is used. So here option B will be the correct answer. Then we can move to the another question. Next question is, which of the following local anesthetic is called universal anesthetic? So the universal anesthetic is lidocaine. So here option C is correct. Next question is, indicate a reversible cholinesterase inhibitor. So the reversible cholinesterase inhibitor will be physostigmine only. So here option C is correct. Next question is, which of the following drugs is useful in the treatment of Parkinson's disease? So the drug which is useful in the treatment of Parkinson's disease is benztropine. So here option A will be the correct answer. Next question is, hypnotic drugs are used to treat. So basically hypnotic drugs are used to treat sleep disorders. So here option B is correct. Next question is, which of the following barbiturates is an ultra short acting drug? So the ultra short acting drug includes thiopental. So here option C will be the correct answer. Next question is, narcotic analgesics should. So what are the different properties of narcotic analgesics? So basic properties, they should relieve severe pain. So here option A is correct. Next question is, spironolactone is a prodrug and its active metabolite is. So the active metabolite of spironolactone, which is a diuretic drug, so it is canrenone. It is a active metabolite. So here option B is correct. Next question is, sumatriptan is used to treat. So sumatriptan is a drug which is used to treat migraine. So here option C is correct. Next question is, which of the following reduces peripheral decarboxylation of levodopa to enhance its therapeutic effects in Parkinson's disease? So these drugs are carbidopa. Basically, I have told you the process, like there is a barrier. This is a periphery part. This is a brain part. So there is levodopa drug. So if carbidopa is not given, then there is also a dopa decarboxylase enzyme. Dopa decarboxylase enzyme. So this particular drug levodopa will be converted to dopamine in the periphery only. But where we need in the brain part. So what happens is, this dopamine has no ability to cross this particular membrane, but levodopa is a product, it can cross the membrane and then it converts into dopamine to produce the desired effect. So in order to remove this particular peripheral conversion, so we will give carbidopa, which will inhibit this receptor for peripheral conversion and allowing it to be absorbed in the brain only. Next question is, stage 2 analgesia anesthesia is a stage of. So stage 2 is excitement and delirium. So here option C is correct. Stage 1 is analgesia, stage 3 is surgical anesthesia, 2 we can write it is excitement, delirium, respiratory depression is number 4. Then moving to the next question. So the question is, optic neuritis is a chief adverse effect of. So basically, optic neuritis is a chief adverse effect of ethambutol. So here option D is correct. Next question is, diethyl carbamazine is used in the treatment of. So diethyl carbamazine, it is used in the treatment of filariasis. So here option C is correct. This question we have discussed multiple times. Next question है, ezetimibe is. So ezetimibe is a drug which act as cholesterol absorption inhibitor. So here option D is correct. That's why it is used in anti-hyperlipidemic uh, drugs. Next question is, captopril exerts action by. So basic mechanism is, captopril is a ACE inhibitor. It prevents the conversion of angiotensin 1 to angiotensin 2. So here option B is correct. Next question is, an organism which has been implicated as a possible cause of chronic gastritis and peptic ulcer is. So this particular organism is Helicobacter pylori. So here option C is correct. Next question is, Mechanism of action of ondansetron is, so the mechanism of action of ondansetron is that it is a 5-HT3 receptor antagonist. So here option D is correct. Next question is, which of the following is LOX inhibitor? LOX is lipoxygenase inhibitor. So LOX inhibitor is dilutin. So here option A will be the correct answer. Next question is, which of the following act as mucolytic? So the drug which act as mucolytic includes bromhexin. It is a mucolytic. So here option D is correct. Next question is, zefurlucast is a, so zefurlucast is a leukotriene antagonist. So here option B is correct. Next question is, Crohn's disease affects the dash part. So basically the Crohn's disease affects the gastrointestinal tract part. So here option A will be the correct answer. Next question is, nefazoline is used in. So nefazoline is a drug which is used in nasal congestion. So here option C is the correct answer. Next question is, chlorpromazine is useful in the treatment of. So chlorpromazine, it is used in the treatment of schizophrenia. So here option C is correct. Next question is, drug of choice in acute lymphatic leukemia is. So in acute lymphatic leukemia, drug of choice is vincristine plus prednisone. So here option D is correct. Next question is, salbutamol is. So salbutamol is chemically the non-catecholamine and beta agonist. So here option A will be the correct answer. Next question is, nicotinic acid lowers down the. Basically nicotinic acids lower down the triglyceride levels. So here option B is correct. Next question is, route of administration of heparin and warfarin. So heparin is given IV and warfarin can be given oral. So here the correct answer will be option number A. Then moving to the next question. The question is, halothane is used as. So halothane is a drug which is used as inhalational anesthesia. So here option B is the correct answer. Next question is, peripheral neuritis of isoniazid therapy in tuberculosis can be prevented by giving. So by using INH, that is isoniazid therapy. So if a person is having peripheral neuritis condition which is due to the use of isoniazid, so that is basically due to the absence of vitamin B6 or lesser availability of vitamin B6. So by supplementing isoniazid with these drugs, so the peripheral neuritis condition can arise. Next question is, which of the following is full opioid agonist? So the full opioid agonist is methadone. So here option A will be the correct answer. Next question is, from following which one is a muscle stabilizer during muscle stabilizer drug used in asthma? So this muscle stabilizer drug is sodium chromoglycate. So here option B is correct. Next question is, identify para-aminophenol NSAID from following. So in this we need to identify the para-aminophenol NSAID. This is basically acetaminophen, that is the paracetamol. So here option B is correct. Next question is, example of gas general anesthetic is. So the gas general anesthetic is nitrous oxide. So here option A is correct. Next question is, which one of the following is an example of antimanic drug? So the example of antimanic drug include lithium. So here option D will be the correct answer. Next question is, which of the following is use of xanthine oxidase inhibitors? So the use of xanthine oxidase inhibitor is gout. So here option A will be the correct answer. Then another question is, which one of the following is an example of opioid analgesic? We need to find out the opioid analgesic. This is the morphine. So here option A is correct. And naltrexone and naloxone, these are the antagonists of opioid drugs. Antagonist. So this you can remember. Then next question is, example of MAO inhibitor used as Parkinsonism drugs. So the MAO inhibitor, so they haven't specified like MAO A or MAO B inhibitor. So we can simply find out the inhibitor. So it is selegiline, which is a MAO B inhibitor. So here option D is correct. Next question is, example of anti-Parkinsonism drug which is also antiviral. So and drug which is anti-Parkinson as well as antiviral also. So this the example is amantadine. So here option A will be the correct answer. Next question is, a leukotriene receptor antagonist used in allergic cough is. So the leukotriene receptor antagonists which are used in allergic cough, it includes montelukast. So here option D is correct. Then next question is, acetyl salicylic acid is. So basically acetyl salicylic acid is aspirin only. So here option B is correct. Next question is, chlorpromazine is an antipsychotic drug possessing. So chlorpromazine is a anti-manic drug, anti-anxiety drug. So the chlorpromazine, it comes under phenothiazine class. So here option C is correct. Next question is, a narcotic analgesic. So the narcotic analgesic includes morphine. So here option D is correct. Next question is, which of the following is NSAID drug? We need to identify the NSAID drug. So this one is the diclofenac. So here option D is correct. Next question is, which of the following drugs is used as a neuromuscular blocking agent? So the neuromuscular blocking agent includes succinylcholine. So here option B is correct. Next question is, which drug is antagonist of acetylcholine? So the drug which is antagonist of acetylcholine is atropine. So here option A is correct. Then next question is, nicotinic action of acetylcholine is blocked by the drug. So the basically the nicotinic action of acetylcholine is blocked by deutivocurarin. It is basically the acetylcholine is a competitive blocker of nicotinic receptor. So here option D is correct. Next question is, a 5-HT1B or 1D receptor agonist useful in migraine is. So this receptor agonist is useful in migraine. So it includes drug which is sumatriptan. So here option A is the correct answer. The next question is, dash is selective arterial vasodilator. So the selective arterial vasodilator is hydrazine. So here option C will be the correct answer. Then next question is, what is the primary mechanism of action of statins medications in treating hypercholesterolemia? So the primary action of statin medication is like these are the HMG coenzyme A reductase inhibitors. So here option C will be the correct answer. Next question is, dry cough is a common side effect of. So dry cough, it is a common side effect of enalapril, which is again a ACE inhibitor. So here option B is correct. Next question is, a potent tranquilizer also exhibits strong hypertensive effect is. So a tranquilizer which is having hypertensive effect is chlordiazepoxide. So here option A is correct. Next question is, salbutamol is a. So salbutamol, it is a bronchodilator drug. So here option B is correct. Next question is, which of the following is an antitussive drug? So the antitussive drug is codeine only. So here option A will be the correct answer. Then the next question is, which of the following is a side effect of paracetamol? So the side effect of paracetamol is It will produce hepatotoxicity or liver toxicity. So here option D is correct. Then next question is, identify the anesthetic which is used intravenously. So the anesthetic which is used intravenously includes propofol. So here option A will be the correct answer. And with this particular question, we are done with this particular section. Now I have provided you all the all the classification of these general anesthetics and other different classes. For example, I'll discuss few, like for inhalational there is a gas subcategory in which nitrous oxide is coming. Then volatile liquids. These includes ether, halothane, enflurane, isoflurane, desflurane, or sevoflurane. And then if I'll talk about the other category, that is the intravenous one. So intravenous includes the thiopentone sodium, methoxytone sodium, propofol, etomidate. And in this intravenous only, there are slow acting drugs as well, in which the first category is benzodiazepine, which is having diazepam as drug, lorazepam, midazolam. So these are the different slower acting drugs which are benzodiazepine derivatives and intravenously given in the general anesthetic. And like that way, dissociative anesthesia example is ketamine, and opioid analgesia example is fentanyl. Then there are several other classifications, for example, NSAIDs, which are antipyretic, analgesic, and non-steroidal anti-inflammatory drugs. So basically, in this also there are several different classes. For example, first class is non-selective COX inhibitor, in which conventional NSAIDs comes under, and there are different many classifications. For example, salicylates is aspirin. Then there is propionic acid derivatives. These are the ibuprofen, naproxen, ketoprofen, florbiprofen. So these are the propionic acid derivatives. Then there is anthranilic acid derivative. It is mefenamic acid. Then aryl acetic acid derivative include diclofenac and aceclofenac. Then oxycam derivatives include piroxicam, tenoxicam, pyrrole derivative. It includes ketorolac. Indole derivative includes indomethacin, and pyrazolone derivative includes phenylbutazone, oxyphenbutazone. Then there is another class which is regarding the preferential COX-2 inhibitors. So these include nimesulide, meloxicam, nebumeton, and etodolac. Then there are selective COX-2 inhibitors. These two categories are very important. So celecoxib, etoricoxib, or paracoxib. These are the selective COX-2 inhibitors. Then there comes the analgesic antipsychotics with poor anti-inflammatory action. So this question can also be asked, like which of the NSAID drug is not having anti-inflammatory effect or very less anti-inflammatory effect. So there are three subcategories again. First one is paraminophenol derivative, in which paracetamol is the example. Then pyrazolone derivative, in which metamizole, which is dipyrone, and propionate, these drugs comes under pyrazolone derivatives. Then in benzoxazosine derivative, nefopam is the drug which comes under this category. So these are the few of the classification, initial classification which I have discussed, and the remaining all the classification are available here from the KD Tripathi MCQ question book. So you can simply read and memorize the things, and like that way you will be able to complete the complete these things basically. So regarding the other videos, I'll try to upload the rest video, uh, the next video, which is of unit number 6. Unit number 6, there will be only one video from this unit, which will be covered in the evening if I'll get time. So if I will be able to make the video, means create the video before 9, then I will be uploading it before 9. Otherwise I will be uploading it on the next day. So this is the video which is the part number 11, and it is coming on 7 a.m. early in the morning. So you can watch, and the PDF has been attached, so you can download the PDF, check the answers, and practice your knowledge. So that's all for this video. We'll meet in the next video. Till then, thank you very much.